Okay, we'll go ahead and get started. It's noon. Hello and welcome. I am Taylor Gilmore, Vice President for Samaritan Foundations, and I'm so pleased to see all of you here today. We're really grateful for this opportunity to share and to learn together. So before we introduce our speakers, I wanted to share some exciting Samaritan Foundations news. Some of you may be aware, but 2021 was year one of our first ever system-wide comprehensive campaign called Stronger Together. And it features local and regional initiatives. And together, the 5 Samaritan Foundations have established big, bold goals to raise $35 million by 2025. And along with that, a bold vision for the future that includes donor support for a variety of critical projects and programs across our Tri-County area. So collectively, the foundations raised $5.6 million last year and allocated more than $4.5 million to meet the healthcare needs of our communities by funding facilities, equipment, services, and education. And so far in 2022, we have launched our Stronger Together campaign website. We've started spreading the message through materials and really encouraging participation. And the campaign theme, Stronger Together, really perfectly illustrates the collective impact that you and donors to the 5 Samaritan Foundations are making in support of Samaritan's mission, which is building healthier communities together. So the framework consists of 4 themes, and these themes really lift up and build upon past successes, organizational and community pride points, and they represent a vision for the health and well-being of our entire region that embodies our shared values. So the framework holds the projects, programs, and initiatives that our local stakeholders have identified as top priorities. So they're listed here on this slide to really ensure the highest quality healthcare for patients, offer sustainable solutions in an ever-changing landscape, and to address the social determinants of health to make a lasting impact on the overall health of all people who live in Benton, Lincoln, and Linn counties. So first, we'll improve access to care through enhanced service offerings and technology in rural settings. So we're going to learn more about that today. Next, we will inspire hope by supporting patients to ensure that everyone gets the care they need and offer innovative approaches to enhanced behavioral health services locally. We will build community through interventions, expanded care for vulnerable patients, both inside and outside our hospital and clinic settings, and take collaborative approaches to solve some complex community health needs. So very exciting. And finally, we will extend opportunities for local donors to leave a legacy of generosity by inviting support that will impact the future of healthcare through things like scholarships, endowments, and our research endeavors. So as we embark on this new comprehensive campaign, we're really excited to build on past successes to demonstrate how, and with our donor community, we are indeed stronger together. So without further ado, we will dive right in and learn more about 3 important projects to improve access to healthcare. And I'm going to turn it over to Brandy, who will introduce our speakers.
Great, thanks so much, Taylor, and good afternoon. And I am Brandy O'Bannon, the director of the Lebanon Community Hospital Foundation. And today it is my honor to introduce our 3 distinguished panelists. Marty Cahill is the CEO of Samaritan Lebanon Community Hospital. Marty has worked for Samaritan since 2007 when he was hired as our Director of Physician Relations for the medical staff of all Samaritan hospitals. He served as CEO of Samaritan North Lincoln Hospital from 2009 to 2015. In 2013, Marty was appointed Chief Operating Officer of Samaritan Lebanon Community Hospital and assumed the role of our CEO in 2015. Dr. Germino earned her undergraduate degree from the University of Chicago and her medical degree from Washington University in St. Louis. She completed a residency in diagnostic radiology at the University of Washington in Seattle and a fellowship in breast imaging at the University of Washington Seattle Cancer Care Alliance. Currently, Dr. Germino is Medical Director for Breast Imaging at Samaritan Health Services and Director of Breast Imaging at Corvallis Radiology. Now Zhao is the Clinic Operation Manager at Albany InReach Services. Zhao started as a AmeriCorps VISTA Program Development Specialist at Samaritan. She has been working with diverse volunteers and partners to ensure healthcare access for underserved populations since 2009. She serves on the Boys and Girls Club of Albany Dental Advisory Group, Samaritan Albany General Hospital Diabetes Education Advisory Committee, and chairs the Linn County Health Advisory Council. So thank you so much, Marty, Dr. Germino, and Mao for presenting today. We're going to go ahead and have each of the three presenters give their speech today, and then just one after another. And then afterwards, we're hopeful that we'll have time for any of the panelists to answer your questions. So again, thank you so much for joining us today, and welcome, Marty. Would you like to kick off the show with talking about Sweet Home?
Yeah, thank you. Thank you, Brandy and Taylor, for having me today. I get the honor and privilege of talking about our Sweet Home project. I have to say that there's a whole team of folks that have been working on this. We're working with the clinic in Sweet Home to develop the new clinic. We're working with the Samaritan Medical Group, administration here at the hospital. So we've got a lot of folks in the foundation doing their fundraising. So there's a great team of folks working behind the scenes to make sure that this project goes without a hitch. And the reason for the project in Sweet Home, I think we can boil it down really to improving access. We want to make sure that the folks in Sweet Home have access to healthcare from Samaritan. And our old building, just a spoiler alert, is not big enough anymore to be able to provide all the services that we need to provide in Sweet Home. So who's this project for? It's for all the citizens in Sweet Home and surrounding areas. We're looking to build a 15,000 square foot clinic there that will meet the needs of the community today and into the future. You know, we'll attach an urgent care to it, a helipad, so that we can, again, people that get injured in the woods and around the surrounding areas that might need to be life flighted out of there. Sweet Home will have a helipad access 24 hours a day when this project is finished. Again, we're going to put it down by the Wiley Creek senior living facility down there at the other end of town. We have 4 acres on the corner that will be perfect for this building. We anticipate breaking ground sometime in the middle of this year. July, August is our tentative date. And again, we want to help enhance the healthcare and improve access for the citizens of Sweet Home. Next slide, please. When we sat down with the city and talked about, and the city has been engaging us for a long time around healthcare, and we've had great conversations with them. We went out and talked to them about potentially building a new clinic on our property, and we wanted to get an idea of their thoughts and maybe some direction that they would like us to consider. And in 2020, the council, city council, and their healthcare committee came up with 5 priorities for Sweet Home. And you can see them here on the slide: urgent care, behavioral health, memory care, long-term care, and physical therapy. And as we looked at this, we realized that assisted living was not our core competency, and we looked to sell Wiley Creek, and we did. And in selling Wiley Creek, we recognized the memory care and long-term care was something that Mosaic was going to want to continue long-term care and create memory care. So when we talked to City Council about moving forward, we had a great opportunity to check the 5 boxes that were of concern for the city and 5 areas that we were able, again with Mosaic, to be able to meet moving forward. So, and I think this list here, if you looked at it and went to any community that we serve or any community in the country, I think that these 5 things would be on a list of any wants or needs that a community would want. And the great news is we're going to be able to check that box for Sweet Home moving forward. Next slide, please. This is our current clinic. Everyone is familiar with this clinic. You know, it's a great location. It sits right on the corner as you come into town. But again, an old building that can't support technology needs and does not have enough space around it to grow. The good news is we'll continue with that clinic as we move forward. But just to level set you, that's our current clinic right now, a place that has served us well, and will continue to serve us well in the future. Next slide. So this is the site by Wiley Creek that we're talking about, and you can see in the upper left-hand corner there that differently shaded building. That's our new primary care clinic, urgent care clinic that we're we're designing right now to build in the middle of the year. You can see the parking lot. You can also see the helipad there by it. But the one other thing I'd like to point out too is that Mosaic bought Wiley Creek. They're running Wiley Creek, and they have future plans as well. That big building just kind of in the middle, bottom middle there, that's their memory care unit. They're talking about building 24 to 48 memory care units there. And then up to the right of our clinic, they're going to expand assisted living. And then to the right of their memory care, they're going to add in another independent living unit there. So again, when you look at this campus right now, from where it was to where it will be in the next 3 to 5 years, we will have a robust healthcare campus down by the Wiley Creek community, anchored by, again, our 15,000 square foot clinic that we're building in July. Next slide, please. Within that clinic, and one would ask, why are we moving out of our old clinic, and why build a new one down at this end of town? And again, that old building can't support the infrastructure needed for a 21st century clinic. When you start looking at it, you can see primary care, a dental office. Again, they've been leasing space for one room, but having dental embedded in our rural health clinic is really important. If you look to the right, having a pharmacy on campus. Again, folks get a lot of prescriptions and they need to find pharmacies to fill them. And we have no space to do those types of things in our old building. So this new building, again, will start to meet the needs of the community moving forward, and afford us the opportunity, again, to deliver integrated care in one building in Sweet Home. I think one of the nice things, too, when we look at this building, is that we'll start to integrate telemedicine. And again, there's opportunities to do that around specialty care and around a lot of different areas that we're identifying every day. And again, if we could drive our patients and our residents in Sweet Home to that building to be able to see a cardiologist or an orthopedic surgeon through a telemedicine visit, instead of driving the orthopedist out there or either way, we really do benefit the community and again, being able to provide enhanced services within that building and within that community. And that's what we're looking forward to do with this new building. Next slide, please. And so here's the project mission statement. Again, as they look to build this new clinic and look to engage the community, you folks can read it. But again, it's just delivering consistent access, reliable, patient-centered care to all members of the community. And again, we do that right now. But again, we'll be able to provide greater services when this clinic is done than we're currently able to do. So they're doing a great job in the space they're in. But again, the enhancement of services for Sweet Home is really the vision of what this new clinic will be able to do. Next slide. So the current state of where we're at with our current clinic, right now it's about 18 days scheduling lag for the next available regular appointment for one of our current patients. So if you look at the next day, if we look at it probably more in a 5-day week, not a 7-day week, we're out 3 to 4 weeks to getting someone in. New patients, again, we're talking up to 40 days, so a couple month lag for next available new appointment. And it's been as high as 120 days. So again, there's access concerns within the community. We want to be able to meet those. And we look at Sweet Home clinicians right now. They have about 7,500 patients on their panels. And unfortunately, right now, no clinician is taking on new patients except for the Medicaid patients in the network. So again, we're limited in space. And in being limited in space, we do not have room for another provider. So again, we're trying to make do with the space that we have, and this new space will afford us the opportunity to see more and do more. Next slide, please. So the growth, and this is really the data that drives our decision to move forward with a new clinic. You can see the population growth in 2010 was just around 9,000, and it's now 10 years later, 1,500 more folks living there. And as we look at folks living in Corvallis, a lot of that market is there's not much real estate there to buy anymore. It's expensive. And then we went out to North Albany and Albany. And now that, it becomes a more expensive place to live. And as you start to get out to, away from those areas, Sweet Home is a drivable distance, and it's really becoming a place that people want to move to. And you can see that with, 350 building permits in 21, which is up 27% from 20. And you can see the data. It's just continuing to grow. I think that the ability to drive from there to Albany or Corvallis, or even down to Eugene or up to Salem, it really becomes a place that people want to start to move to, are moving to, and again, we need to set up our clinic and set up our ability to deliver care there, so that we can meet this growth and the projection of growth into the future. Next slide, please. And so the current clinic, and the one thing I want to level set everyone on, the current clinic will in the future continue to be our space. We will utilize it differently, but so when you see current clinic, we will have that. So the 10,000 square feet we have today, we will be adding somewhere between 15 and 17,000 square feet in our new clinic. So we'll have 25 to 27,000 square feet in Sweet Home to provide services. So we're going to have a lot of space out there for growth. We currently have 6 providers. The goal with the new clinic, as again the data supports the need is there, we hope to grow, be able to grow to 9 providers, so that we'll be able to again meet the access needs for that community. There's currently 11 exam rooms. That's going to move to 18 rooms. And then there's going to be 2 talk rooms. So again, when you have to sit down and have a conversation with an individual or a family, they'll have some rooms to go to, so to not tie up an exam room. So we again keep the flow of the clinic going smoothly, allow patients that have scheduled time to get in and see their provider, but also have a space to have some conversations when the time arises. So again, we're looking for the opportunity to meet people and meet the needs of the community right there in that building. Right now we have 4 walk-in exam rooms. It's only walk-in right now to support the overflow of the clinic patients currently. The goal in the new clinic is to have 7 exam rooms for urgent care, and again, start to raise the level of care that we offer in the urgent care realm above a walk-in acuity. And again, the hours at the current clinic are 8 to 5. And as we open the new clinic, the goal will be, again, to have potentially more hours in the day, whether we open earlier or stay open later. Still discussing that. And then especially with the urgent care being open 7 days a week, and being able to provide those services in that community every day, so they don't have to drive to Albany or Lebanon to receive that care. Again, those are the goals that we put out there when we open the new clinic. Again, it'll depend on our ability to hire the staff to meet those needs, but those are our goals right there, that when we open the new clinic, we'll be able to have enhanced hours out in Sweet Home. Next slide, please. And some of those enhanced services that I've been mentioning, and you've seen in the schematic, retail pharmacy will be something new in that building, and I think that it'll be very much, I think it'll be received very well. It's a need that that clinic has. Dental care, we've been providing it as a co-location with Capital Dental. They're going to lease space from us and actually have a dental office there, so that'll be fantastic. Laboratory, behavioral health. One of the big ones, again, as I talked about, telehealth. We'll always be looking for ways to provide services in Sweet Home to take advantage of telehealth, and not only Sweet Home, but across the system. But more importantly, again, as we build this new building, we want to be very, very cognizant of the idea and opportunities around telehealth. Again, getting new clinicians in, and then adding more clinicians in the next 2 to 4 years to meet the access needs within the community. So the time frame, we sold Wiley Creek, as I mentioned, back in October, and that's going well. Mosaic's doing a great job. Clinic design is happening right now. We're working hard on that, anticipating, again, a July groundbreaking, construction start, construction complete early to mid 23, and then the remodel of our current clinic for physical therapy and rehab services spring or summer of 23, we'll go in and refresh that building, and again get the exterior refresh on that, and then work through all the space issues and such internally inside that building. So we'll get that fixed up the middle of 23. Next slide. And finally, for those who want to know more about the project, we're going to have a virtual town hall meeting on March 3rd. We'll have the foundation involved. We'll have SMG there. We'll have Liberty Petruti, the operations director. We'll have some folks there to talk about exactly what's going on within that clinic and that build. So I invite you all to, if you want to know more about the project, we will be talking about it then. Thank you.
Hi, I'm Jessica Germino. I am the medical director for breast imaging at Samaritan Health Services and with Corvallis Radiology. And I want to talk to you a little bit about access to breast imaging in general terms. What technology do we use for breast imaging, and what does that access look like? Next slide, please. I don't have any disclosures for you. I am a scientific advisor for a company that does develop X-ray detectors. Next slide. So accessibility of breast imaging resources. There are a number of technologies that are essential to the toolbox of detecting breast cancer. Mammography or mammograms, that's really the foundation for breast cancer screening and breast cancer detection. Large studies have shown that use of screening mammograms saves lives. Early detection saves lives. And so we really depend on mammography as our main tool for detecting breast cancers. Breast ultrasound can be used in conjunction with mammography, as well as of evaluating breast tissues that can really build on top of the use of mammogram to increase our detection. Breast MRI is a very limited resource with very specific indications that I will discuss. And finally, when we detect something that is suspicious, when we're in the process of diagnosing a breast cancer, we need to do a needle biopsy in order to make that diagnosis. And I'll talk about the different technologies needed in order to achieve that goal, so access to those technologies. Primarily, this is done with mammography as a guide for biopsy and ultrasound, less commonly with MRI. Next slide, please. 3D mammography access has been a very critical component of screening mammography in the last decade. In 2011, the FDA approved use of 3D mammography, or tomosynthesis, which is the technical term for this technology, into use, and it has really become the standard for mammography considered amongst many specialists. So a 3D mammogram uses X-rays to create a 3D image of the breast that a radiologist like myself can scroll through in order to detect abnormalities in the tissue. And this is compared to a flat or 2D mammogram with conventional mammography. 3D mammograms are important because research has shown that they can increase the detection of breast cancer, which is our main goal, and also decrease what are called false positives, okay? Callbacks and thinking that we found something, but it ends up being normal tissue. Research over the last decade since the introduction of tomosynthesis or 3D mammography has demonstrated disparities in access to 3D mammograms. So vulnerable populations, there's a discrepancy in the accessibility of this very important tool in certain communities. Next slide, please. In Samaritan Health Services, I'm very proud to say that all of our mammogram units are 3D. All of our screening mammograms are done with tomosynthesis or 3D mammograms. This map here just demonstrates the sites that mammography is available in our communities. And at each of these sites, all that we offer is 3D mammograms so that there is nice distribution of access in our community to this important technology. One thing I would like to say that as our population increases, as was just discussed, we're seeing in Sweet Home, for example, one of the challenges moving forward is how we can continue to offer this technology to growing populations. And I must say that I am very thankful and pleased that the foundation has identified this as an area for growth, to continue to supply our communities with enough screening mammogram units so that we can continue to keep barriers to access to mammography low and identify breast cancer in our communities. Next slide, please. As I mentioned at the beginning, another technology that's very important in our toolbox for breast imaging is breast ultrasound. This picture here is just an example of what an ultrasound looks like of the breast compared to the pictures of mammography you saw on a few slides back. Ultrasound does not use x-rays, so there's no radiation, and it produces pictures of the breast tissue that we can use to aid in diagnosis, but also to aid in biopsies. So we can use live ultrasound to direct a needle in order to do a biopsy when we see a suspicious lesion in our efforts to diagnose breast cancer. Next slide, please. Access to breast ultrasound is similar to that of mammography. All of our mammography sites are similarly equipped with breast ultrasound, and so any of our 5 sites can utilize this tool alongside mammography and make a large number of breast cancer diagnoses. Importantly, also for access, we are able to perform ultrasound-guided breast biopsies at all 5 of these sites, at all 5 of the Samaritan hospital sites, to offer this important tool for diagnosis to all of our community and populations, including our rural health, those in our rural community. Next slide, please. Finally, the last technology that we use in our toolkit is MRI, so breast MRI. MRI stands for magnetic resonance imaging, and it's a way of using a powerful magnet or magnetic field along with technology, including radio waves and very strong computers, to produce detailed pictures of breast tissue. It does not use x-rays, so there is no radiation. This is a more limited resource throughout the world because MRI machines take up a lot of space, are very costly, and there's a lot of patient preparation for these examinations. So this illustration here demonstrates how we perform breast MRI. When we do an MRI, the patient is on her stomach to allow the breast tissue's better visualization. There's a coil underneath the breast getting strong signals so that we can see the tissues of breast tissue very well. We also give contrast agents to help see blood flow in the tissues and aid in our diagnosis. Next slide, please. As it is a very limited resource, regardless of the location, there are very specific indications for breast MRI. Some established indications, as put out by many physician groups and the American Cancer Society, include women who are at an increased risk of developing cancer in their lifetime, which is greater than 20 to 25 lifetime risk of breast cancer, usually from a genetic inheritance or family history. New breast cancer diagnosis is eligible for breast MRI to evaluate how much of the breast may be involved by breast cancer, and it allows a higher level of screening of the other breast at the time of cancer diagnosis. In some patients who are taking a chemotherapy medicine to shrink a breast cancer, MRI is used along the course of treatment to determine how that breast cancer is responding to the chemotherapy drugs. Breast MRI can also be utilized for solving problems that we cannot sort through with mammograms and breast ultrasound alone. So for example, a common indication would be a woman presents with bloody nipple discharge, which is a suspicious finding. If the mammogram and ultrasound don't give us a clear indication of the source of that problem, we can go to MRI. It may be able to better detect the source of that problem than conventional imaging with mammogram and ultrasound. Breast MRI can also be used to find breast cancer that is not detected on mammogram or ultrasound. So the most common situation would be, and this is a rare scenario, but the most common situation in this case is a woman presents with a large lymph node in their underarm. It's biopsied and found to have breast cancer, but there's no breast cancer in the breast seen with mammogram or ultrasound. We can use an MRI to try and detect that hidden or occult breast cancer not seen with conventional mammogram or ultrasound. And finally, we can use MRI to evaluate if a silicone breast implant has ruptured. That's a final indication, and we may not need to give contrast or use an IV for that examination if we're just looking at the integrity of a silicone breast. Next slide, please. Access to breast MRI in our system is in Corvallis. We have two different MRI machines. One is a lower field magnet that has a larger tube or bore, which is ideal for people who might be more claustrophobic for better body comfort. And we also use it when patients have certain devices that are only compatible with a magnet strength of 1.5 Tesla. So certain pacemakers, you can have an MRI, but we would typically do them on this machine. So that is in the hospital in Corvallis. In the outpatient imaging building, Neville building, we have a stronger magnet, which we do most of our breast MRIs on the stronger magnet, but it is a smaller tube.
Hi there. Thank you for this opportunity. I'm pleased to share with you the work of our team and partners in addressing healthcare access for the underserved population. Let's get started with an introduction to Albany InReach Services. Next slide, please. Albany InReach Services is a volunteer-based team committed to providing free medical and dental services for the low-income and uninsured population. Our free medical clinic takes place at the Linn County Mid-Willamette Health Center on Thursday evening, 5 to 9 p.m. Most of our patients live in Albany and requires ongoing care for their chronic conditions, such as diabetes and hypertension. We also see patients from Millersburg and Tangent. Since Affordable Care Act, we started to expand care access for patients who only have emergency medical coverage. This is a group of patients who couldn't afford to seek care with a primary care provider. So since our free clinic has a capacity, and we started to see patients that only have emergency medical coverage. Next slide, please. This includes providing free medication for our patients who are challenged with limited resources. In 2021, we provided $61,000 of free medication to 189 patients. That averaged to $322 prescription cost per patient. Since most of our patients require multiple prescriptions and ongoing care, we also make sure these patients are getting relevant labs completed accordingly to their care plan. When the care plans include a specialist referral, we work with SHS Patient Financial Services to cover the specialist referrals costs. Next slide, please. The pandemic has impacted our patient volume by 50%, but we are working closely to attend their follow-up appointments or getting their medication renewal and refills. Our providers can review this patient's chart and call the patient as needed for medication renewal. We normally schedule a volunteer nurse or medical assistant at each of our clinic. Since COVID limited quite a few student volunteer opportunities at clinic, we are lucky to maintain our commitment to supporting our student volunteer in their professional growth, and most importantly, providing opportunity to foster their interests and passions to work with the underserved population. We rotate through our student team of 9 pre-med students, 7 first and second year medical students from Comp Northwest, and 10 pharmacy students from Oregon State University. Most of the student volunteers stayed with us until they moved out of our area for the next phase in their life. Generally, that's about 2 years of volunteer work with us. We also recognize the importance of engaging community volunteers. So we're always open to figuring out volunteer opportunities for everyone who wants to help the underserved population in regard to healthcare access. Next slide, please. Our dental clinic has a different structure. It's a direct partnership with the Boys and Girls Club of Albany. We are grateful to the Albany General Hospital Foundation for funding our monthly dental clinic at the Boys and Girls Club of Albany. Next slide, please. The funding covers dental supplies, a dental assistant, a dentist, and a bilingual health navigator at the Boys and Girls Club for adults. When an insured oncology patient needing dental screening, the oncology social worker, next slide. Thank you. In addition to funding from the AGA Foundation, we also receive funding from Sir Optimus International, Albany, and United Way. To make all this happen, we rely on quite a bit of support and expertise from Samaritan Health Services and the Albany General Hospital Clinic Administration. This support enables our volunteer team to also serve as a link to resources, connecting homeless patients to the SHS Care Hub. The pandemic has helped us figure out additional resources for our Spanish-speaking patients. We have been partnering with Global Nutrition and Empowerment, a 501c3 nonprofit, to provide nutrition and diabetes education using mobile technology. The pandemic has also made us reflect on valuable partnerships such as with Oregon State University College of Public Health and Human Sciences. Next slide, please. It's all about teamwork with Albany InReach Services and building together. 3 clinics are still needed to ensure equitable health care for the underserved vulnerable population. And we're seeing the changing population throughout the year, and we're committed to continue to serve our community. Thank you again for allowing me to share the work of our amazing team of volunteers. On behalf of all of us at InReach, we're grateful for this opportunity and for those in need. I welcome any question or suggestion you may have for our team.
Wonderful, Mal. Thank you so much. And thank you, Dr. Germino and Marty. It's really exciting to hear about all the great initiatives we have at Samaritan to increase access. And thank you, all of you, for attending. We do have plenty of time for some discussion and questions. I would encourage you to go ahead and use the raise hand feature in Teams, or if you want to put a question in the chat and then let us know what presenter you'd like to hear from. We would welcome your questions at this time. Yes, Daryl?
Yeah, Dr. Germino, I'm just curious, are the 2 MRI machines located in Neville, are they shared MRI machines, or is there a specific MRI machine for breast exams, or is that just all shared MRIs?
Oh, good question. So we have one in the Neville building and one in the hospital, and these MRI machines are shared with every other examination we do. So in the hospital, the ER may be coming through, or inpatient exams that are stat. And then Neville's all outpatient examinations, scheduled examinations, but it's for every body part. What makes the MRI able to look at other different body types or different body parts is that's called a coil that's added to the machine. So we have specific coils to look at the brain, to look at the belly, to look at the breast, to look at the joints. But it's a shared resource. So for breast MRI, one of the biggest challenges is getting enough time on that magnet for especially our breast cancer patients, which can be a bit of a struggle.
Okay, so if there was an additional MRI machine, it would have multi-purpose, but yeah, that makes sense. Okay, so it doesn't seem like very many just with the 2 machines for all of our needs, I'm guessing.
I think that I would always welcome more magnet time for my breast patients. You know, it is a limited resource, MRI in general, but I think with breast MRI, there's growth needed in that area.
Okay, thanks.
Thank you.
So we did want to draw your attention to, if you'd like some more information, Marty referenced that we will have a town hall about specifically the Sweet Home Project. So I'd encourage you to go to that website, samhealth.org/town hall, if you're interested in learning more about Sweet Home. In particular, we will be sharing schematics of that building for the first time, so a little more detailed about the services provided there. And then this is MedTalk, kind of one of a series of talks, as Taylor explained, about our different campaign initiatives. So please consider joining us in May, where we'll talk about programs here at Samaritan that inspire hope for patients. We'll be talking about opportunities to leave a legacy of generosity in August, and initiatives to build community in November. So those are great learning opportunities. There's more information on our website. So, and again, thank you so much for attending. I'm not seeing any other hands up. Again, we have time for questions if anyone has them, but we will give you a few minutes of blessing with extra time in your lunch hours. So again, on behalf of all of our colleagues here at Samaritan Foundations, thank you so much for joining us, and thanks again to our presenters. Have a great